MedPeds resident is somebody that is flexible and adaptable, but with somebody that has really good heart.
People who are drawn to MedPeds are unique, and they have the best of each field, and it's absolutely reinforced day in and day out here in the program.
They are literally covering every floor of the hospital.
We see cases much like a community hospital will, but in more of a tertiary setting.
Residents really get a diverse opportunity to work with patients of all walks of life.
You have to kind of think on your toes, be creative, think outside the box.
We have excellent internal medicine and pediatric residents, and that balance between the two categorical programs really allows for the residents to have excellent training on both sides.
This is a place with a relatively lower burden of fellows, so you have basically more attention from your attending and you have more opportunity to manage things yourself rather than to defer to fellows for management. So I think we have a really strong clinical base here, and in some ways we may have more opportunities for that than larger academic centers may.
I looked around and saw the residents, and I saw the people who I wanted to be like. It was a group of people who were cohesive and smart, but also down to earth. And they just created a very welcoming environment.
They have demonstrated to me just tremendous leadership and a lot of the values that this institution stands for.
You work really closely and one-on-one with the faculty. They really do get to know you. I still run into them all the time, all around the hospital, and they know who I am, and they are always checking in. It's just reflective of the culture here.
One of the things that's a little bit different about our program here is because we are in a more rural state, is the residents all participate in 1 to 2 rotations in a more rural setting.
If you're familiar with Bahaba, as they say, I am in Bar Harbor, Maine. My first week, it was pretty wild. I was very busy. I was dealing with some really chronically sick people. You have to do a lot on your own without the luxury of subspecialists and things like that. So you're managing a lot of things on your own, and so that's just like a whole new animal that you don't really experience in Maine Med, so it's been great.
Having the opportunity for autonomy is a significant priority of this program.
For example, at nights, whether you're on internal medicine or pediatrics, the nurse calls and you're there at the bedside and you're making those decisions. You've got the attendings backing you up, and you have people to go to. You never feel like you're out there on your own, but you still have that space to make those decisions.
Our MedPeds clinic actually came as a surprise to me. Here in Portland, surprisingly, we have a very large refugee population.
The residents are there 5 days a week, rotating through at various times, and they each carry their own patient panel of adults and pediatric patients.
It's a little intimidating at first. Now a year out and having seen several of my patients many different times, I think it really helps to build a bond between you and your patients. They identify you as their primary care provider.
They are all amazing people. They receive the people well, and they are doing their good jobs. So that's why we feel free, we feel comfortable to speak with her.
Rebel Street Learning Collaborative cares for people experiencing homelessness, and we do what we call slow medicine there. One resident once said to me, "Everywhere else people are telling me to be more efficient, and you're telling me to slow down." And it's really an opportunity to hear people's stories, try to understand the world from their perspective, to push back your compassion buttons and put that back into place.
For me, it has more to do also with the community, that this is unusual to be able to work in a tertiary type center that's doing pretty much everything that's done at some of the big academic institutions clinically, yet to have the beach right down the street, the ski area less than an hour away.
It's just fun. I think there's something to do in all seasons here.
There was a good combination of people who wanted to have the academic rigor, but also valued your life outside of the hospital.
You don't have to put off big life things just because you're in training. My residency program was very supportive of that.
Maine Med is in a pretty ideal location with easy access to beautiful places like Bar Harbor, Maine. It's got wonderful people and a rather competitive salary.
Our program is really heavy on a sense of community and family and belonging.
It's really become a home for our residents.
All of my co-residents, all of my faculty feel like are always checking in or making sure we're all doing well, or just there and get to know us as human beings and not just as resident physicians.
I'm really biased, but I think we have pretty amazing residents.
Because I knew residency was going to be hard, and I wanted to put myself in the place where I knew I was going to be happiest. So that for me was Maine Medical Center.